Hello everyone, myself Sneha Kautkar. I am second year BHMS student from PBHMC Chandrapur. I am here to give the presentation on burns which is guided by Dr. Siraj Khan sir.
Now we will discuss the topic burns under the following headings. Introduction. Burn is a type of injury caused by the application of heat or other agents to the body, leading to the damage of skin or deeper tissues. It is basically caused by the heat, chemicals, electricity, radiations or frictions. Burn injuries are covered under the various sections of IPC depending on whether the burn are simple, grievous, intentional or due to the negligence. Types of burns. First, thermal burns, which is caused by heat. The sources are flame burns, sclads, contact burns. Chemical burns, which is caused by strong acids and alkalis. Acids like sulfuric acid, hydrochloric acid, or alkali like caustic soda or lime. Electrical burns, which is caused by electric current passing through the body. Types are low voltage, high voltage, flash burns, true electrical burns, etc. Radiation burns due to the radiation exposure, for example, UV rays, X-rays, etc. Cold burns, which is generally caused by extreme cold and damages the tissue like a burn. Friction burn caused by rubbing of the skin against the rough surface. Classification by the degree. First is first degree burn, which is a superficial burn. It only involves epidermis and the skin becomes dry, painful, and there is no blisters. And this heals in 3 to 5 days, for example, sunburn. Second degree burn is partial thickness burn. First type of second degree burn are superficial partial thickness. It involves epidermis or upper dermis. In this blisters are present and it is very painful and it heals within 1 to 3 weeks. Deep partial thickness involves epidermis or deeper dermis. It is pale or red in color and it is less painful, slow healing and may need grafting. Third degree burns are full thickened burn. It involves epidermis plus entire dermis. Skin becomes dry, leathery, waxy or charred. It is painless, nerve endings get destroyed totally and it requires skin grafting. Then there is a fourth degree burn which extends to the muscle, tendons or bone. It keeps tearing associated with high motility. Fifth degree burn is the destruction of the muscles or deeper tissues. It usually seen in severe fire, etc. Sixth degree burn is the complete calcination of bones, is seen in forensic cases and it is extremely severe. Causes of death in burns. First is immediate causes. It causes within minutes to hours. First is shock. It includes neurogenic shock or hypovolemic shock. Then second is asphyxia. There is an inhalation of smoke, hot air or toxic gases like cyanide. Airways swell and there is a respiratory obstruction. Early causes, it cause in first 1 to 3 days. It includes acute respiratory failure, acute renal failure and circulatory collapse. Late causes. After 3 days to weeks, first is infection or sepsis. It is the most common late cause. There is the burn wound infection, pneumonia or septicemia. B. There is the toxemia. There is the obstruction of necrotic tissues toxins. Then multiple organ dysfunctioning syndrome and like kidney, liver or lung failure. Very late cause, it is from weeks to months. There is a complication of poor healing like ulcers, then electrolyte imbalance, then secondary hemorrhage. Then there is a medical causes, that is homicidal burns with associated injuries, that is strangulations, blunt trauma, etc. Then carbon monoxide poisoning, especially in closed space fires. Postmortem findings of burns, external findings, charring, blackening, singeing of hairs, pugilistic attitude, blisters and line of redness. Internal, there is soot in airways, carboxyhemoglobin increases, then airway edema, congestion, lung edema, hemorrhage, etc. Then heat artifacts, that is heat ruptures, heat hematoma, pugilistic posture and heat fractures. Antemortem versus postmortem burns. In antemortem burns, there is a line of redness, and in postmortem burns, there is no line of redness. Here, vessels and blisters contains serous fluid with albumin and chlorides. In postmortem burns, there is vesicles contains air only. In antemortem burns, there is infection, pus, sludging. The base of blisters are inflamed, healing with granulation, etc. In this postmortem burns, the infection pus is absent, the base is dry, hard, yellow, then absence of reparative processes, then vital reaction present in antemortem burns and absent in postmortem burns. There is increase in enzymes reaction and SH group in periphery of burns. There is no increase in enzyme reaction in postmortem burns. Treatment includes first aid, wash with cold water, remove tight clothes and jewelry, cover with clean cloth, don't burst blisters. Then ABC assessment with which includes airways, breathings and circulation, and then fluids. Parkland formula is given here and which gives a Ringal lactate. Wound care includes clean, debrid, silver, sulfidazine dressing. Pain and prevention includes tetanus toxoplasmosis. Medico-legal significance of burns are: it helps to determine the cause of death, the manner of the death in accident, suicide and homicide. It helps to distinguish between the antemortem versus postmortem burns. It is important in dowry death cases and domestic violence. Detection of accelerants, then identifies inhalation of injury, helps estimate survival time and treatment received, important for insurance and compensation cases, support identification of charted body like DNA and dental. Thank you.